Welcome, everyone, to the final day of the 2025 Putting the Pieces Together conference, a conference by and for people living with pain. I know, I see the hearts too. It's amazing. My name is Jenny Lorca, and my pronouns are she, they, and sha. And as a steering committee member for this conference, I cannot tell you how meaningful it's been for me to share this space with all of you this week. As a child of immigrants, a settler of color, and a person who lives and loves with pain and chronic illness, my family and I are grateful for our rich existence on the traditional, unceded, and stolen lands of the Coast Salish First Nations in what is colonially known as the Greater Vancouver Area. This land is home to so many First Nations, Métis, and Inuit peoples with whom I am humbled to have shared bread, knowledge, and support. So before we dive in, I've got a few housekeeping notes. Excuse me. This session will be recorded and available on the Pain Canada YouTube website and channel after this conference. For translation, look at the CC button at the bottom of your screen, and then to access translation and closed captions, click on that CC button and then select your desired languages. Simultaneous French audio translation is available. Merci to all of our translators this week. We know we've been working you hard. And so to access this, please follow the Zoom link posted in the session description. If needed, information about where to seek help in crisis during this conference is available in the Pain Canada section of the exhibitor area in the Zoom platform. So exhibitor bar at the top, click on that, go to Pain Canada, and then on the right-hand side, you'll see downloads, and those resources will be there. A gentle but firm reminder to folks that when you're putting things in the Q&A or the chat, please be mindful of being respectful so that we can ensure that this is a brave and safe space for all. For those of you who communicate through social media platforms, please use hashtag PTPT2025. So welcome. Today we will have 3 sessions. The first one is digital health tools for chronic pain management. The second is gentle movement, befriending the body. And the third one for the day and for the conference is managing the future of pain research. And then there'll be two 15-minute breaks between sessions. So session, break, session, break, session. Please remember that this conference has been designed for and by people living with pain. And while it's open to everyone, we've done our best to design it so that we can create a brave and a safe space for people who live with pain. And while we hope that there are clinicians and researchers who are also here to listen and connect, please spend your time listening to people who live with pain rather than using these spaces for research or other purposes. I've been saying all week what an incredible privilege and joy to be with, dream with, build this invaluable collective of some of the most excellent human beings I know. I'm grateful for the people on the steering committee, past and present, who've become my friends and co-conspirators, and for the Pain BC and Pain Canada team that supports us, who are also my friends. What a tremendous thing we've built together. So I'm officially declaring myself the conference steering committee Tita. I would also like to thank the conference sponsors: Pain BC, the Strategy for Patient-Oriented Research, the Chronic Pain Network, the Canadian Institutes for Health Research's Institute for Musculoskeletal Health and Arthritis, the Partnership for the Engagement of Patients in Pain Research, or the PEPPER Partnership, and Health Canada. Many of our presenters will share stories and perspectives shaped by their individual lived and situated experiences. The views expressed do not necessarily represent the views of Pain Canada or our sponsors. And now, I am super happy to introduce my friend Haley, who is the moderator for this first session. Welcome, Haley, and welcome guests.
Thank you so much, Jenny, and hello, everyone. My name is Haley, and I'm also a steering committee member for planning this conference. Today, I'm excited to delve into this topic in particular with experts that focus more on research being done on chronic pain using digital tools and the development of revolutionary applications for individuals with chronic pain that are trying to manage it. And a part of the session, I will also present on my chronic pain management using specific digital tools and applications that have been very resourceful and beneficial for me. But first, I want to start off with introducing the experts that are a part of the session. A co-steering committee member, Alex Hagar, she will be sharing her insights on her research for DigiMIS, co-creating a digital tool to diagnose and triage musculoskeletal conditions in the community. So this is again around chronic pain management for that particular condition. Next, we also have Lauren Harris, who is also a renowned expert from the Hospital for Sick Children. And finally, we have Tahir, sorry if I botched your last name, Jan Mohammed, who is the founder and CEO of Managing Life, which is a company focused on developing digital applications that are patient-centered for chronic illness management. So I'm so excited to have them a part of the session and talking about their research as well. So first, I'll start off with my presentation, and then I'll pass it off to Alex to present on her research. Okay, hopefully you all can see my screen. So first I want to talk about my journey suffering from chronic pain over the years. And I've already mentioned that I'm a steering committee member, but I also work for the digital health team for the government of Nova Scotia. And I'm also a graduate student working on my thesis, again, linked to digital health application for student well-being. So I'm very much submerged daily in this area. But over the years, chronic pain isn't just physical challenges, it also affects other areas in my life, which creates limitations for my routines and restricts me from doing things that I used to love a lot, like running, jogging, socializing with others, and often counseling plans with others because of my pain. And if we want to go back to when I first started having chronic pain, I was around 17 years old. I got pneumonia and I was rushed to the ER. And it's just been a journey since then. At first, it was very hard to find even a provider in Nova Scotia that could help me. And most providers said, because I'm young, I'll get better. And some providers were just unable to diagnose. But eventually, over the last 8-9 years, I've been diagnosed with pulsatile tinnitus, which is constant. I even hear it now. And even more rare is the cause of it, which is a structural sigmoid sinus diverticulum. But most recently, I also got additional diagnosis of anemia and potentially intracranial hypertension. So it's just been a journey to say the least. And at first it just felt hopeless and I felt helpless because I was unable to figure out what it was in the first few years. And so to me, the digital tools and applications are a way to feel some control and not sort of let the pain overtake me or consume me. So I'll be discussing these particular applications I use, but again, about the challenges with chronic pain so you can get a little bit more understanding around that, because visibly sometimes you don't see the symptoms in a person. But for me, daily, I have light sensitivity and migraines with vertigo, and more recently, pain when I'm actually eating. So eating is a task because I have the sensation. And I already mentioned the restricted routines. The main pain point I have in Canada is delayed and inconsistent treatment in Canada. I actually had to go to the States and then come back and then do testing from a provider there to get a more comprehensive evaluation. And so my daily life is just shaped around managing my pain, fatigue, work, studies, and everything else. So now I'll talk about the applications that actually give me some peace of mind. Um, and just a slight disclaimer, I'm not endorsing any of these products. These are just products that I found useful for myself and might be useful for you, might not. So I'm not endorsing any of them, but you'll see information on the exhibitor area about these products. So first, I want to mention the Mobvoi treadmill. It's sort of a mini at-home treadmill that you can have virtual running and sort of control as well the pace. And that has been helpful because I used to be involved in the run club and so forth. And so controlling the environment and having my own at home little setup is it allows me to continue that because running now in outside in that environment is actually quite dangerous for me because of the condition can make you faint while you're actually running. So the other component, other application that I really love, and this is the one I tend to use every single day or every other day, is my VR or virtual headset. The one that I have is the MetaQuest 2. I got it over 3 years ago, and that sort of enables me again to do physical activities, but you can also socialize with your friends in the virtual environment if you can't leave your house. So if I'm in extreme pain and I have something that I was going to plan to do with a friend, we can actually do that virtually instead of meeting in person. So I'm still connected. Um, and then finally, I wanted to mention a wearable. So there's various wearables out there, but in particular, I use the Hume Band, which sort of helps predict the onset of chronic illness. And for me, it was quite accurate because the last time I got ill, I actually planned vacation based on the different indicators or variations in health measures that I was seeing on the Hume app, and I actually did get ill during that vacation time. So it worked for me, but there are other wearables like Whoop or Apple Watch and so forth. And then finally, I wanted to mention about Manage My Pain app, and Tahir will get more into that because his company developed this. So he will get more into that. And so this app also helps to identify patterns and triggers related to your chronic pain and the severity of your chronic pain. You can sort of monitor that and see at certain periods of times, whether it be seasonal or maybe when you're under more stress, you can sort of see if the severity changes. So with that being said, thank you for listening to my presentation on my lived experience and the digital tools that I use. I'm going to pass it off to Alex now to go into their presentation on their research, in particular for musculoskeletal conditions.
Thanks, Haley. And let me just try and make sure that I open up the right thing and share the right window. Oh, and let me start on the first slide so you're not on a big, weird, awkward introductory picture of my face. There we go. All right. So this is maybe a little bit of a grandiose title because I have like 3 slides to present here. And sorry, I'm also not in presenter mode. Let me just switch that. There we go. Hi, I'm Alex. I'm a design researcher, and I'm also a person living with chronic pain and illness. And I am lucky enough that sort of in my capacity as a patient partner, I've started to have the opportunity to merge both of those kinds of expertise and contribute to the development of new digital tools and services that I think can hopefully help empower particularly underserved patients and communities. And that's something that I'm really interested in relation to digital health, in relation to digital tools. I'm really interested in sort of thinking about, are there ways, oops, I just noticed I didn't actually finish. No, I did finish, sorry. I was rushing to finish these slides. So I want to talk about a few ideas in particular during our conversation today. One of which is that technology and society shape each other. So I think we're very used to thinking of digital tools as just tools that exist in isolation. But I come from a sociology background, and there's a very particular way of thinking about technology in that field, which is that technology is sort of just an aspect of society, and technology and society really do shape each other. Technology shapes the ways that we behave. It's obvious that society shapes the ways that we create and use technology. But thinking about those intersections are really important, especially when we're talking about something like healthcare, something like chronic pain, because you can't just throw a tool into a community and expect that it's going to work for everyone. You can't throw a tool into a system or an organization and expect that it's going to be usable or taken up or used in the ways that you expect. So studying those sort of intersections between people and organizations, and seeing how that shapes use, and in turn how that shapes how we should design these tools, I think is a really crucial thing to be thinking about. And that's why I'm a really big proponent of co-design, and especially bringing community members, patient partners into the earliest stages of design. I would say even sort of before you start the design work itself, to say, like, what are the questions that we're asking? What are the assumptions that we're making in deciding what project we should even be pursuing, right? And so that means rethinking evidence too, because we talk a lot about evidence-based medicine, but what we call the highest levels of evidence in medicine are sort of very much based on population views, and they often sort of don't capture, or they sort of smooth over the differences that many of us experience, especially when people are underserved, especially when they've had experiences that haven't been sort of captured or recognized by the healthcare system. And then in turn, what often happens is that when people sort of try and report those experiences, they're told, well, that's just one experience. That's not what the literature reflects. So it's about how can we bring those experiences into the early stages of the process and start to actually create evidence around them, and treat lived experience as its own form of evidence. And in turn, how can we bring that way of thinking into healthcare interactions and into how we treat patients as partners in their own care? And I mean that in a very holistic way, not just sort of delegating them to sort of think through solutions themselves, but how can we actually empower them to create shared language around, like, how we're diagnosing pain, and how we're thinking through treatment plans. And then finally, asking who isn't in the room and why, because even in sort of meaningful, inclusive design situations, I've so often seen a situation where it's like, well, those people don't use our product or these kinds of products anyway, so it doesn't make sense to talk to them. And it's like, well, no, those are exactly the people you want to talk to. If you want to create sort of meaningful, innovative change, you want to know why people aren't using your product and what it is that they actually need, because there's a good chance they have a need that isn't getting met anywhere. Again, especially in a field like healthcare, where I find sort of solutions often tend to converge to sort of similar patterns for good reasons, and yet at the same time, it often means that those people who are already underserved continue to be underserved, and that underservedness gets reinforced. So I want to talk about these couple of projects that I'm involved in. And we're at the very early stages of the research in both of these. So I don't have any sort of exciting artifacts to show or anything. But I want to talk a little bit about the process that we're using. So DigiMSK is an interdisciplinary research group based at the University of British Columbia in the Department of Physical Therapy, led by Dr. Claire Ardern, who is herself a physical therapist by training, but is doing something really exciting in the way that she's taking an interdisciplinary approach to leading this research group. So she's brought together clinicians, designers, including myself, healthcare administrators, and most importantly, people with lived experience to design priorities around mapping healthcare technology ecosystems. And this is a strategy from my field, from service design, which is really about tracing out those, the different people, the different digital tools, but also the different sort of languages and communication norms and processes that are all involved in those intersections of people and technology in healthcare, and sort of mapping out those relationships, and then trying to figure out, okay, where are their pain points, where are there opportunities to create change. But understanding those relationships in all their complexity feels like a really important first step. And then from there, co-designing new patient journeys through the healthcare system. Where are those pain points? Where are the gaps where people are getting underserved? And that may not just mean in terms of sort of not being able to get in the front door of care, but once they're getting in the front door of care, how are they still not necessarily getting their needs met? And then finally, co-designing tools and services, really crucially, to tool, because what we've sort of found in very preliminary research is that the red flag questions, there are some standard red flag questions that get asked to triage when you come in with chronic low back pain, for example. And we're looking at chronic low back pain because it is such a common one, and it's also such a complex one. There are so many different possible causes of chronic low back pain. And as a result of this, there are sort of clinical decision making. I say algorithm in the non-computer sense of the term, but an algorithm for how you make decisions about where to send, sort of which clinical pathway to send a patient down when they come to the ER or the urgent care, or if you are lucky enough, the primary physician. But what we're finding is that while those red flag questions have been designed with very specific meaning and a lot of clarity for the clinicians who ask them, there is a lot less clarity for the patients who are asked them. And there's a lot of uncertainty around what is actually being asked and how to answer correctly. And because of the power imbalances that exist in the clinical interaction, patients don't always feel comfortable asking for clarity, or if they do, depending on the clinician, they can be judged as a problematic patient, which changes the care trajectory from that moment. So one of the things we're exploring is how can we leverage digital triage tools to get past that sort of language barrier that exists between clinicians and patients, because clinicians have their own language, their own logic for thinking about pain, which is different than the people who are experiencing pain. And the burden of trying to bridge that gap right now often falls on patients themselves, and it really shouldn't. So that's sort of the pain point we're trying to alleviate with this particular project. And I skipped over my other slide somehow. But I'm also working with a group called ATEC. So it's the AI and Technology Enhanced Care Collaboration Center. And this is a research excellence cluster based out of University of British Columbia. And it's really focused on, again, bringing together interdisciplinary partners. So clinicians, folks from industry working in design, working in tech, academic researchers, administrators, policymakers, and again, crucially, community members, to talk about what do AI and tech futures look like in healthcare, and sort of not trying to be overly technologically optimistic about these conversations, but sort of recognizing the reality that AI and digital technologies are getting taken up in healthcare. So what are the concerns that we potentially have? What are the ways to mitigate harms that we're concerned about? But also, if there are gaps in the system, what are the gaps we're experiencing? What are the ideal futures that we imagine for healthcare? And are there ways to leverage technology to address those gaps? So we're at the very start of a community engagement process, and we're doing some speculative design, which I find really exciting because it's not often that you get to do speculative design in academic health research, to try and, explore some of those ideas around how can we sort of come up with creative futures for healthcare that are led by the people who are most underserved by the healthcare system. So I will wrap it up there. But I've got some email addresses if you are interested at all in sort of becoming a patient partner or a community partner for either of these projects. Please do feel very free to reach out to these email addresses. And I think that Carolyn is going to drop them in the chat as well if she hasn't already.
Thank you so much, Alex, for your presentation there. And I believe, sorry, it's still a little bit in haze from my presentation talking about my lived experience as well. So decompressing from that. But Lauren, you are next on my list. So pass it over to you.
Hi, everyone. Thank you so much for having me, Pain BC and Pain Canada. And it seems like it's been such a great conference so far. So very happy to be a part of this. My name is Lauren Harris. I'm a research project manager with the IOUCH Pain Lab at the Hospital for Sick Children. which is led by Dr. Jennifer Stinson, who's a nurse clinician scientist with the Chronic Pain Clinic here at SickKids. So today I'm going to share some of the work that we do and what our process is for developing some of these digital solutions for pain management. And I have a couple of videos as well to show some of the tools that we've developed. So some quick facts on pediatric chronic pain. So we know it's a significant problem across Canada. 1 in 5 kids are directly affected by chronic pain, as well as it has a significant economic impact. And we know that when kids are impacted by pain, there are a number of other negative impacts around poor sleep, missed school, low mood, activity limitations, and loneliness as well. So our lab at SickKids is, our goal is to develop and test digital solutions to empower kids to better manage their pain and improve their symptoms. So here's a little picture of us, Dr. Stinson's there in the middle, and we're located here in Toronto. So I wanted to share a little bit about our process that we use. So we use a real phased approach, which starts with people with lived experience, and it always includes them as partners throughout the process. So the very first step that we always do before we even apply for a larger grant to develop a tool is a needs assessment, where we do interviews and we meet with patients and families and usually healthcare providers as well to really understand what users would want in a tool, and that we keep a very open mind of what that tool will look like and take input from the people who would be using them. And then we design the tool. We always do some usability testing with end users, and then we evaluate it using a larger randomized control trial and pilot tested as well. And one thing I wanted to focus on was that this process is very iterative. So we never move on to the next step until we kind of check back in with our patient partners, make sure that everybody's kind of in line with the vision. So just as an example of how we engage with patients and families is, here's a photo of our youth advisory team that we put together a couple of years ago when we were developing a program called Power Over Pain. And that's an online program or online portal that I'll share a little bit more about. But just wanted to show some of the faces of people who have been involved with this program. They really helped shape what the portal looks like, what kind of resources are included. And even the branding, the look and feel of it was really led by this group of individuals across Canada. So Power Over Pain, and this logo was actually designed by one of the members of the Youth Advisory Committee. So they really did shape what it looks like. So it's a one-stop shop. It has free resources for pain management for young people living with pain. And I'll just show a short video so you can better understand what it
Pediatric chronic pain affects 1 in 5 youth and has significant impact on quality of life. Over the past few years, our teams at SickKids and Alberta Children's Hospital led a national effort to meet the need for a one-stop shop where youth can freely access evidence-based tools and resources to manage their chronic pain. This one-stop shop is called the Power Over Pain Portal for Youth. It is now freely available in English and French at popyouth.ca. We used co-design methods to create the portal in collaboration with youth, their families, and healthcare providers. The portal includes evidence-based virtual resources to help minimize the toll of chronic pain and mental health issues on youth. To help youth quickly find what they need, the resources are organized into pain, mood, worry, sleep, and substance use categories. Upon creating an account at popyouth.ca on their smartphone, tablet, or computer, youth will immediately have access to the suite of resources. They are also encouraged to complete bi-weekly self-assessments that are located on the check-in page. The results of these assessments will inform further resource curation that can help your patient cope when they are in pain and bridge the time until their appointments. Please encourage your patients to seek power over their pain by visiting popyouth.ca. Contact us at power.overpain@sickkids.ca.
Hopefully nobody can hear. There's an alarm going off in the building. I'm so sorry. Hopefully it's not too distracting for you. I can hear it faintly in the background, but
Pediatric
we'll
chronic
carry on. So that was the Power Over Pain portal, which was developed by that youth advisory group. One optional feature within the Power Over Pain portal, or one of the resources, is a peer mentorship program called iPeer2Peer. It's offered to all participants at the time of consent. One thing that surprised us a little bit was how high the uptake was of this program. So more than half of the people who signed up for the portal actually did opt in to be paired up with a peer mentor, who is a young person, a young adult with chronic pain who has kind of successfully managed with their pain and was nominated by their healthcare team as potentially being a good mentor for younger teens going through it. And I have one video for this program as well.
Hey there.
Hi.
I'm Liz.
And I'm Lindsay.
So were you a little nervous for this call?
Yeah, a little.
I'm super nervous, so I won't lie.
Okay.
So I don't know much about you, but I'll tell you a little about me. I'm not exactly sure the type of arthritis you have, but I'm assuming you do have arthritis, right?
Yeah.
Okay, so I have systemic juvenile.
Being a teenager can be stressful. You have a lot to think about, like school, friends, family, hobbies, and everything else. Now imagine being a teen with a chronic or long-term disease. You would also have to think about and manage medical appointments, medications, and therapies, and all when you're not feeling 100%. Learning to be independent and take care of yourself and your health can be complicated. Many young people who are living with a chronic disease have never met another teenager with the same condition. It is easy to feel like nobody around you gets it. So to help, a team of healthcare providers and researchers at the Hospital for Sick Children developed the iPeer2Peer program. iPeer2Peer uses online video calls to connect young people living with the same disease. Teens are connected with someone a little bit older who has gone through training to be a mentor. This is someone who gets it, someone who has been in the same situation and has learned how to cope.
My name is Shayla, and I live with chronic pain, and I am a mentee.
My name is Carly, and I'm a mentor.
My pain story started in 2010 when I was in a motor vehicle accident. So I have pain from my neck all the way down to my feet. I have nerve problems in my feet. It was really difficult for my friends to understand because obviously they're not going through what I've been going through.
One of the benefits of this program is that it was completely online. So there was no geographical limitation whatsoever. So if you were getting treatment at a hospital anywhere in Canada, or if you were living across the province, or even in different time zones, you could still connect with your mentee because it was all online.
I'd Skype her on my bed, I'd be like this with my phone up here, hey, yeah, I'm not feeling well. But with the Skyping, it was really easy because it's I could still feel bad, but that would be the best time to talk to my mentor.
This is a program that I never had the opportunity to experience while I was a patient here at Sick Kids. I wish I had had the opportunity to meet a mentor, someone older who successfully was managing their pain and could learn strategies from them.
She offered me a way how to live with what I'm dealing with, because I know one of my biggest things was being able to accept it, and I ended up telling my mentor that, and she said that the only way for anybody else to understand what we're going through is in order for us to understand it ourselves. Yes, I've had bad days, and yes, I will have bad days and continue to have bad days, but what you do on the good days will overpower the bad days all the time.
This is such a promising program. I can reflect on even one of the mentees that I had that they mentioned that they are looking forward to actually being a mentor one day and hopefully having this experience available to them just because they enjoyed the conversation that we had and the relationship we built so much.
I'd love to be a mentor in the iPeer2Peer program because I've seen how it's helped me. So I'd love to give back and help someone else never give up, keep going. Remember where you started off. It would be good to be able to get that motivation back going and being able to help someone else.
I actually don't have any other questions. No, it was really fun being your mentor.
It was really fun being your mentee.
So if you have any other questions or anything, you know where to find me. Good luck with everything.
So that was the iPeer2Peer program. And one challenge that we always have with developing these programs and these tools is sustainability. So with the iPeer2Peer program, a program called Cassie and Friends, which is an advocacy group out in BC for kids with juvenile arthritis, has actually taken this on, and they run the mentorship program. So anybody who wants a mentor now, young people with arthritis, can sign up for that program with Cassie and Friends. So that's been a really successful partnership. And just before I wrap up, I wanted to share some of the other programs that were being developed in our lab. So I'll just highlight 3 of them in the interest of time. This little robot here is a robot that we have in the emergency department at SickKids. We just wrapped up a pilot study to see if he would be helpful in calming down kids who are going to the emergency department and getting IV insertion. So that's a painful needle procedure. And kids and parents loved seeing it so far. We're still analyzing the data, but that was a fun project here. We also use VR, and Haley, it was interesting to hear how your experience with VR has been helpful. This is a program that was meant to supplement physiotherapy program for kids, mostly during COVID when they weren't coming to the hospital as much, so they could actually bring the equipment home with them and they could supplement their physio appointments at home with physiotherapists developed programs. So it would kind of tailor for different arms or different types of movements that their physiotherapist recommended that they work on. So that's the PRVR study. And then I Can Cope, lastly, is a self-management app that was developed, and that is for young people with chronic pain. It's one of the free resources within the Power Over Pain portal, so it's freely accessible. And it's been tailored now for chronic pain, arthritis pain, post-operative pain, neurofibromatosis, as well as sickle cell disease pain. So just closing thoughts, I just wanted to highlight the importance that we see in including youth and families as part of the research team throughout all stages of the project. And developing in digital tools really is an iterative process. So we often go back and redo things based on patient feedback and patient input. And finally, just that digital innovation can really successfully empower young people with tailored programs that are accessible and effective and sustainable. So that's just a little highlight for the Power Over Pain portal. If anyone's interested in looking more into it, it's pocyouth.ca. And this is also our lab research website where you can learn more about any of our projects. And thank you again.
Okay, thank you so much, Lauren. And it's very interesting hearing about the peer-to-peer program and all these other studies that is happening within the pain lab, especially with youth, because there's a lot of misconceptions around having chronic pain being youth, whether you're an adolescent or young adult. So thank you so much. And last but not least, I'm going to pass it off to Tahir.
Thank you so much. Thank you for allowing me to be part of this conversation. It's just an honor to be sharing a little bit more about what we do, and more importantly, learning about what exciting innovations are happening elsewhere. I love what Alex talked about in terms of involving the patient from day one in the process. Lauren, many of those innovations I hadn't heard of before, so it was fantastic to hear about that. And I think both of what you talked about is also how our company and how I approached this challenge and our solution as well. I had the idea for Manage My Pain, which Haley had mentioned earlier, and I'll talk about it shortly, when I was working as a management consultant at IBM. And I spent 8 years there, and I didn't love what I was doing because I didn't feel like it was helping people. My background is not healthcare. I come from computer engineering. I'm a tech and data person. But I thought while I was at IBM, if there was any way that I could bring my unique skill set to helping people living with pain, I'd love to be able to do that. And what inspired me was my mom's own experience living with pain. So she has severe fibromyalgia. And growing up, I heard her telling her doctors, my dad, you don't get what I'm going through, and just not being believed. So I thought if I could bring data to that conversation, or patients, they could better articulate what they're going through and hopefully get believed and get the care that they need. But on the flip side, for the clinical care teams, having some data to support treatment decision-making, as opposed to just relying on what someone is saying in that moment in that clinical visit, could hopefully find the right treatment at the right time. So that was the inspiration behind Manage My Pain. The first version was launched back in 2011 as the first pain tracking app on Android. And fast forward to today, it is one of the most downloaded globally. So we know that 1 in 4 live with chronic pain. There was a recent study that came out, I think it was 2 months ago. It used to be 21% of the population. Now it's 24% of the population. And I don't have to tell you all, the way that pain is managed is broken. If someone is able to be believed, and time and time again, I think over 50% of people living with pain will tell you some story about how they've been dismissed at some point. You just need rest and recovery, or take some Advil and come back. There's nothing I can do. Or worse yet, it's in your head. We've heard all of these stories from our users. But if people are able to get treatment, unfortunately, treatment is centered around two main categories of things. Physical things like surgery, physical therapy, devices like neuromodulation stimulation devices, or medications, nerve blocks, opioids, cannabinoids. But researchers time and time shown again that the gold standard for managing pain is a comprehensive multidisciplinary approach that includes those things, absolutely, but also includes education, self-management, pain psychology. And unfortunately, the sad reality is there aren't enough multidisciplinary pain treatment centers in Canada. Haley mentioned Nova Scotia. My understanding is there is one multidisciplinary pain treatment center in the province, and they have a 4-year wait list. And so it is really hard to be able to deliver that. So what we try to do is try to use digital solutions to close some of those gaps, obviously not all of them. And we do it with what's called Manage My Pain. Now, what we started off with was a way for people to have a voice, to track their condition, so that when they do go to seek out care and they get asked, "So, tell me how you feel," they actually have some data to be able to answer that question in a more objective way. And so, unfortunately, what we found is that it's really easy for people with pain to forget that they're still able to do things despite their pain. And so we developed it with our partners at the University Health Network, something called a daily reflection. So at 8 p.m. every day, there's a little reminder that goes off on your phone, and we don't ask you about your pain. Instead, we ask you to think about what you did in your day that was meaningful and important to you, and write that down. Remember that you can still do things, and you have done things sometimes, and it's important to focus on the wins as well. Then we ask you to describe your pain, and we do it in and out in less than 60 seconds. Where does it hurt? How much does it hurt? What triggered it? What have you tried, both medication-wise as well as non-pharmacologically? And over time, we play back that information through charts and graphs to highlight patterns and trends, as Haley had mentioned. The idea here is to give you a little bit more insight into what you probably already know, but it's very helpful to see that objectively through some charts and graphs to help you understand, is my migraine getting worse when it's cloudy outside? Or when I exercise in the morning, my back hurts at night. Finding these patterns and trends gives you a little bit more sense of control. And then more importantly, you can generate reports like the one you see behind me that actually tells your story. You can go to your doctor and say, my pain is real. It looks like this. You can take it to your surgeon, to your chiropractor, to your physical therapist. Rarely are those people talking to each other, and they're dependent on what you tell them. So this is a language. Now, alongside that, we also try to support people or users with the Pain Guide. Now, this is a set of educational resources and toolkits that are 2 to 3 minute micro-learning modules written at a grade 6 level that are based on evidence-based pain psychology concepts. It teaches people about the physiological nature of pain and introduces coping strategies that a pain psychologist might talk to their patients about. How to overcome anxiety before surgery, how to reintroduce dental movement when it's really scary and hurtful to do so. And it's based on acceptance and commitment therapy, CBT, all of the things that pain psychologists typically use when speaking with their patients. In January of this year, we actually worked with the University Health Network to develop a more structured pain psychology program. They have one pain psychologist at the Transitional Pain Service at the Toronto General, and they found that they couldn't see everyone. So they started doing group psychology sessions over Zoom. And not everyone wants to sit in front of Zoom for 4 hours. And so they weren't getting as much reach as they wanted. So we worked with them to create a digital self-guided version of the same concepts. And that was also rolled out in our solution. But just last month, we launched, what I believe is going to be a really big evolution in using digital health and AI to support people living with pain. And we launched Solace. Solace is a unique thing that is first of a kind in the world of pain management. It's not a chatbot like ChatGPT. Instead, it was built to actually emulate what a pain psychologist does over a multiple set of sessions. It tries to understand your journey using the information that you tracked in the app to actually personalize it and really understand the impact that pain has had on you in your life and those around you. And then it matches people to evidence-based non-pharmacological interventions and helps build a management plan with you. What you can do over the next 4 to 5 days when you have that next pain flare up, and tries to teach you some of the skills, if you're not familiar with them already, on how to practice that. It also develops a more longer term strategy over the next 2 to 3 months And because it ties back into the tracking aspects of the app, it gets updated and personalized over time. So it knows exactly that you had 3 pain flare-ups since the last time you chatted with Solace. We actually ran a clinical study that showed after a single 30-minute session, people had significant improvements in things like resilience or acceptance. And we're running a number of different trials to show how this could actually support people alongside their existing pain management plan. My goal is to try to close the gap in pain psychology that exists so that if you live in Iroquois Falls in Northern Ontario, or if you live in Lethbridge and you might not have access to these comprehensive multidisciplinary pain treatment centers, or you've been sitting on a wait list for 3-4 years, you have something that can give you some of this type of support. And so that's our goal as a company, and that's what we've launched most recently. So thank you so much for having me and allowing me to share a little bit more about Manage My Pain. Feel free to reach out to me personally. Our website is managinglife.com. The app there is a free version. Our goal is to offer it in a free way as much as possible. There's obviously a paid version as well that unlocks some of the other features that I had mentioned today as well. But thank you so much.
Wow, to hear. Thank you so much for describing the Manage My Pain application and Solace, which is, I have no doubt, I'll take some time myself to even look into more of Solace, but having something like that in your toolkit as an individual with chronic pain really would be beneficial for helping me stay on top of managing my symptoms and so forth. So thank you. It's just an amazing news to hear the development. And for the last few minutes, we're going to jump into some discussion questions that I prepared beforehand for each of our experts here. And maybe first, let me start with Alex, this question in particular. So given the complexity of chronic pain as a biopsychosocial phenomena, how can digital tools better integrate multidimensional data across all those domains to create truly personalized pain management plans?
Yeah, that's a great question. And I'll be honest, I'm someone who bounces really hard off of the biopsychosocial model. My approach to design research is grounded in my lived experiences of the fact that I have never been offered anything but so-called psychosocial interventions for my pain. For a variety of reasons. I'm someone who I'm read as a woman. I'm non-binary, but in medical settings, I'm read as a woman. I have never had anyone to advocate for me in clinical settings. Growing up as a child, I didn't have parents who could advocate for me effectively. And as an adult, I still don't. I'm neurodivergent, which is related to the lack of having anyone to advocate for me effectively. And it also means that I don't perform pain in normative ways. And I'm therefore read as a hypochondriac who's read a little bit too much of the Dr. Google when I come into clinical settings. And also, I am unlucky enough that my pain is not the kind of pain that tends to show up readily on scans or imaging. And I think something that we often forget when we're sort of chalking pain up to psychosocial or sort of emphasizing the psychosocial dimensions of pain is that there are a lot of conditions that take many, many years to show up reliably on scans and imaging. And I think we gloss over that part of the patient journey because as soon as someone's symptoms do not correspond with their scans or imaging, we put them in the psychosocial box. And for however many years until it does start to show up reliably on scans and imaging, they are offered nothing but sort of self-management and lifestyle changes and psychological interventions when what they really do need is in fact medication. So I mean, my dream is to see how we could leverage AI, how we can leverage machine learning, natural language processing, to interpret from what patients are saying, to more effectively draw patterns in how patients are describing their symptoms, and connecting those to pathophysiological mechanisms. I know that's a really grandiose idea, but I think there's something really valuable in there, because I think fundamentally we need a different paradigm of how we diagnose and approach the treatment of chronic pain, because relying so heavily on scans and imaging means that so many people lose years of their lives and are then sort of just told it's on them to manage their symptoms more effectively themselves. And I think another thing that I sort of want to call out too, when we talk about sort of psychosocial approaches to pain, we really only mean psychological, right? We're never focusing on giving people access to affordable, accessible housing. We're never providing people with care workers who can help them with the day-to-day of their lives. And that in and of itself creates a real barrier to self-management, because if you're already struggling to purchase groceries, if you're living in inaccessible housing, which is causing you even more pain, if you have to work full time so that you can afford housing that is semi-accessible to you, how are you going to manage your stress levels? How are you going to take that time to exercise? So something I'm really, really curious about too, and I think it's a real challenge with digital health tools, because the thing with a digital health tool is that to use a designery word, the affordances, the structures and the physical nature of digital tools. We don't think of digital tools as physical things, but they live in a person's single device. And they're a thing that you typically sort of interact with one-on-one, or at best, you interact with the social media community. But it's still very much sort of emotionally tinged. It isn't about sort of material world support, because that's just not what the affordances of digital health tools easily lend themselves to. But I don't think that that means that it's impossible. But this is why I'm so interested in sort of these speculative design approaches and bringing patients in to even ask, like, what are the questions we're asking wrong about how we define pain, about how we assume people are experiencing pain care, and who's getting left out of the way that we imagine pain care is being delivered or not delivered, so that we can start to think about, like, okay, yeah, what are the real structural and material dynamics that we need to challenge, and are there ways that we can do that with digital tools?
Well, thank you, Alex, for your thoughtful response there, especially the integration part and sort of evaluating how we actually use those digital tools in what context is very important to address every domain. So thank you so much. And then the second question I have here is, with increasing concerns about digital surveillance and data monetization, what are your thoughts on how developers and healthcare providers can build transparent and patient-centered frameworks for these digital tools? And to hear this question is for you, and I did see one question in the Q&A about concerns around data privacy, so maybe you can allude more to that.
Yeah, absolutely. When we went down this pathway and we were trying to partner with the University Health Network, we completely broke the model, because at that time, our position was anyone using our application owns their own data. It seems very obvious today, but when we went down that path in 2015, the hospital felt like they owned the data and were responsible for it. Fast forward to today, that model has shifted and the mentality has shifted, but that still remains true. Our users own their own data. We will never disclose it without explicit consent to do so. And that is inherent in what we've done since day one. We do say that we may aggregate and de-identify for research purposes. We've published a number of papers highlighting patterns and trends. And the idea there is to try to advance understanding in the world of pain management, but we're completely transparent in what we do. And in fact, we offer an offline mode. So if you don't want data leaving your device, you can use our application and choose not to do that. My approach is offer people the flexibility to use our solution in whatever way they feel suits their situation, which includes completely offline. You can turn off Wi-Fi and still use it, for example. So, but at the core, people own their own data, and it should never be viewed anywhere else, in any way else. Needless to say, we don't commercialize or sell data. So, in case that wasn't obvious, we don't do that.
Of course, that would be a huge concern for any user, and naturally, that's something's always disclosed before you start using the application. So, thank you for your response there. And then, Lauren, this is a question for you, and it's sort of our final independent question. The last question I have is actually for all three of you, if we have time. But for this question, what role can digital tools play in shifting the chronic pain narrative, especially for young adults or youth? from symptom management to proactive prevention and resilience building. And you have discussed some of the studies and the programs within your pain lab already doing this, but maybe you can sort of reiterate some of that.
Yeah, thank you so much for the question. So the way that we develop our digital tools is that the goal is really to empower people to better understand their condition and also to build up their own coping toolbox of strategies that work for them. So not everything is going to work for every person and not everything is going to work at any time. So as an example, the I Can Cope app that we've developed is something where a youth can actually track their symptoms, track their pain, and start to see those trends over time. And then based on what they're putting in, there will be personalized feedback back to them. So suggested goals that they could create within the app, suggested articles that they could read. For example, if sleep has been an issue, it would direct them to look at the sleep-related content and kind of tailored content that way. So as the app pushes relevant in the moment strategies, we hope that people will start to make the connections of what has worked for them in the past, and then they will be empowered to use those tools moving forward independently. And just as one other example, we really recognize the importance of transitioning to adult care as well. So that's more of an issue with the pediatric area, of course, but that can be a really scary transition for a lot of kids moving from the children's hospital up into the adult world, where a lot of the people managing chronic pain are not within their age demographic. So one just very specific example that's in the I Can Cope app is a tool called the 3-sentence health summary. And that allows, it kind of coaches youth on how to create a very concise summary as a tangible tool they can bring with them to their appointments, and they can communicate with the healthcare team about kind of what they've tried already, what worked, what hasn't worked, and then specific questions that they want to get out of the appointment. So kind of giving them the tools to make the most out of those healthcare appointments and get what they need out of the appointments.
Okay, thank you so much. And just one last question for us to dive into this, and this is for all of you. So looking ahead, what innovations or improvements in these tools do you believe could significantly transform chronic pain management, at least within the next 5 years?
I'm happy to jump in. I think it's obvious from my perspective. I think AI has a significant opportunity to transform. Sorry, let me rephrase that. To close the gaps in care that will probably never be closed by humans. I don't think it's a replacement for human care, but it's better than, and I hate to compare myself to this, but to nothing, which is what unfortunately many people have. And so I think that's the role that I believe AI can play. And I believe that's one of the most transformative opportunity areas moving forward in the next 5 years.
I think, yeah, I'll jump in. I think one thing that I'm really interested in and excited about is, again, sort of a gap in the patient journey that I've noticed, at least within Ontario, is that when you have sort of a complex presentation that doesn't easily fit into a particular clinical channel. So I've talked about sort of with chronic low back pain, if you have certain red flags, it'll sort of shunt you into a particular clinical pathway. So they have red flag questions for, is it inflammatory pain? Is it infectious? Is it cancer, traumatic injury, forgetting one neurological? And based on which red flags you have, they'll shut you into sort of a referral, or they'll send you back to your, again, if you're lucky enough, family doctor to get a referral to that appropriate channel. But the problem is, as we know, a lot of chronic pain disorders have the dreaded non-specific symptoms and overlapping symptoms, which creates a lot of diagnostic complexity. And we don't have a good solution for the fact that if you get shunted into the wrong pathway, it's not really easy to get redirected back into the right. When you get sent to the specialist and they're like, well, you don't have rheumatoid arthritis. And it's like, okay, well, what do I have then? They're like, oh, probably mechanical pain. But what if you have MS? Then you go back to your primary care doctor and like, hey, can I get a referral to a neurologist? And they're like, why are you so attention seeking? And so I would love if we could build tools that sort of helped simplify that process of sort of creating clarity out of diagnostic complexity, that helped elucidate for patients what are the diagnostic clinical pathways, journeys that you can follow, and help them pick and choose, and also sort of help them frame their requests as they're interacting with healthcare professionals. I think there's something really potentially valuable there that could sort of, meaningfully challenge some of the power imbalances that we've lived with for literal centuries in clinical medicine. Not to get too grandiose again at the end.
Well, we don't have much time. I think we're right on the dot right here. I wish we could go into more questions and everything, but again, thank you for engaging in this session and presenting on your research, your applications, all the work that you're doing. It truly is remarkable. And personally, I really didn't feel like Canada had a bright future because of my experience to go to the States and have to come back and manage all this. But starting to paint a picture that we do have a bright future here and supporting our citizens with chronic pain. And again, thank you so much for the work that you do.
Thank you, Haley, Alex, Lauren, and Tahir. I got so distracted by listening that I forgot to chime in. So, and that says a lot about how meaningful and impactful and innovative your work is. And I wish we could have more time for all of these conversations. Remember that everyone, that these sessions are recorded so you can rewatch later. And also on Monday, November 3rd, many people living with pain joined Alex and Delaine's session to share helpful life hacks living with pain. These hacks, they wanted just to let you know, to let all of us know that these hacks will be posted on Pain Canada's website under resources for people living with pain. And then they'll also be sent out with the recordings after the conference. And I believe, Haley, you too mentioned that there were quite a number of resources that came up in this conversation too. And I think you're compiling a list of resources to put in the exhibitor hall. Is that my understanding? Yeah.
Yes, yeah.
Okay. Yeah, so the exhibitor hall will be open for 1 month after this conference closes. So I'm putting that out there. We are going to take a short, approximately 15-minute break. And in the meantime, we invite you to continue to check out the session schedule and visit the exhibitor area. Our next session is Gentle Movement, Befriending the Body. Please return in about 15 minutes. That's 11:15 Pacific, 12:15 Mountain, 1:15 Central, 2:15 Eastern, 3:15 Atlantic, and 3:45 Newfoundland time. I totally got all the time zones. Looking forward to seeing you at the next session. Thanks, everyone.